Okay, so the humerus, this is the bone of the arm, so between the pectoral girdle and the elbow joint, and there are a number of anatomical features that I would like to point out to you. The head of the humerus is what fits into the glenoid cavity of the scapula, so that's what actually forms the attachment between the humerus and the pectoral girdle with the scapula. The anatomical neck is this region right here. That's in contrast to what's referred to as the surgical neck, which is a little bit lower down. The surgical neck is going to be a site of rather frequent fracture, and that's why it's referred to as the surgical neck. But the surgical neck is essentially a narrow part of the bone between the head and the main part of the shaft. Then we have the greater tubercle, the lesser tubercle, which is basically just this little protuberance here. The intertubercular sulcus is the groove basically between the greater and lesser tubercles. So you'll see that there's basically a low point between these two landmarks. That is the intertubercular sulcus. And another term for this is the bicipital groove. So whichever one you remember is acceptable. A lot of folks go with bicipital groove. This is an attachment point for several muscles, including the tendon that attaches, one of the tendons that attach the biceps brachii muscle to this bone. So bicipital groove or intertubercular sulcus. The deltoid tuberosity is an attachment point for the deltoid muscle. And some of these you'll see once we get into the gross anatomy of muscles. These same terms you'll be seeing in that material as well. And then keep in mind that this is an anterior view, so this is the front of this bone. The distal portion at the elbow joint, we have the capitulum, the trochlea, which almost looks like a wheel in a lot of ways, or a spoke. And then there's the medial epicondyle. So remember that you have this wonderful resource in your book, I believe it's table 8.2, that talks about bone markings. It defines the epicondyle. It is a term that is used for protuberance on the ends of several different bones. And it's just this top part here. So an epicondyle is basically on top of a condyle. And it's medial because it is on the medial side. So the medial epicondyle is going to be right here. So it's closer to the midline of the body. Now with the forearm, we have the ulna and radius. Always remember that all of these positions are in relation to anatomical position. So I had you all demonstrate anatomical position in class where we stood up, feet are about shoulder width apart, hands are out to your side, palms facing forward, head facing forward, but the key part of this position in terms of talking about bones of the forearm is going to be your palms are facing forward. So the ulna and radius in the supinated position, which refers to palms out, are actually going to be oriented differently than they are in the pronated version or position, where you just have your arms hanging naturally at your side with your palms facing towards the back of your body. So the ulna and radius will actually cross over when you are in that pronated position, but if you're in supinated position, the radius is always going to be lateral and the ulna is always going to be medial. So the ulna is the medial bone. It forms the major portion of the elbow joint with the humerus, whereas the radius is the lateral bone in the forearm, so it's going to be on the same side as your thumb. The head of the radius one way that I remember these two bones is the head of the radius is actually very round. So when you're looking at models of these bones, you'll probably notice that the head of the radius is very round. And remember, of course, that you have a radius associated with a circle. So that's one way that I remember radius versus ulna, is you look at where they're actually closest to the elbow is going to be the head of the radius, and it is very round. So the head articulates with the capitulum of the humerus and with the radial notch of the ulna. And then between these two bones, we have a membrane known as the interosseous membrane, which of course literally just means between bones, basically. Interosseous membrane, which connects the radius and ulna along their entire length. And I showed a short video in class that basically explains, one of the advantages of having that interosseous membrane is if you fall and you place your hands in front of you to brace yourself and to avoid head injury, help yourself avoid a more serious injury with a fall, a lot of the force is going to be distributed through that interosseous membrane, so it's not just one of those bones that is receiving the majority of force. It's kind of distributed across both the ulna and radius, and that is advantageous in terms of avoiding more serious injury.